and colleagues. Thank you very much for taking the time and the effort to be here today. It was very important from the Green Flag Association to put these updates out every now and again, especially as we're heading into the fourth wave. Hopefully we'll be able to give you enough information for you to be able to brief the public properly to certainly mitigate or lower the impact of the fourth wave. And that is really the ambition and the goal of what the Green Flag Association is about, is to work on this as a directive so that we can actually have an influence and an impact. And we definitely a call on the media houses to be able to work at this. The session is being recorded, so that's awesome, and we'll be able to actually upload that to our YouTube channel a little bit later on, as well as I'm sure it'll be circulated to you with the link. And then the journalists will obviously all get a media pack as well that will have a storyline in it, and you'll be able to refer directly to that, and we use it as well. So we know the fourth wave is starting in the roundabouts. Right now, our numbers are sitting in the sort of the 300 odd new cases per day. When we hit our peaks, we're sitting between 15 and over 20,000 per day. So we really are in the trough of it now, but we've been here for some time. And we know when we look at the previous trends, we're going to be heading into it sort of around about the mid-December through January. So yeah, Christmas and all those sorts of things, we have to be hyper vigilant with all that socializing and Shisanyama and all that sort of thing. We've got to make sure that we are completely aligned with what we can do to prevent the spread and the transmission of the disease. And yeah, Green Flag is very clear on its position around ventilation and vaccination. And the ventilation side of it is really the core area where we actually function and have expertise. And this is kind of what we're going to do today. We're going to update you on some of the aerosol science, and we're also going to look at some of the practical ways that you can actually deal with clearing the air. Let's call it that, I think. So joining me today is Dr. Gareth Cantor. He's an anesthesiologist. He's basically a gas fundi, and he's got tons and tons of experience in that area. He's also an honorary lecturer at the UCT, assistant professor in the Case Western Reserve University in Cleveland. He serves on the faculty in the Institute for Healthcare Improvement. He's also obviously on the Green Flag expert panel, and he's been incredibly active in the media as well. He's done quite a lot of projects on transport and been involved in those projects. He's involved with the carbon dioxide monitoring personally himself, and he's been working with the Groote Schuur Hospital, I think, recently, Gareth. I'm sure you'll be able to fill us in on some of that. And you know, the Green Flag expert panel, I serve on that as well. I'm an exposure specialist. I've got 30 years experience in exposure science, and I've got a master's in public health, and I'm a registered occupational hygienist for SIO, and I'm one of the founder members of Green Flag. So really, Green Flag, one of those associations that has been born out of the pitching and hitting from the rough, because there's been this real lag of information around ventilation and the important part that it plays in bringing the disease down. But the expert panel has got lots of different and diverse experts on it. So myself and Gareth represent two of about 9 or 10 of us from medical backgrounds. We've got professors, we've got research scientists, we've got medical experts, exposure specialists as well. It's a very diverse thing, panel as well, and we are very, very active with that. We've got very good associations with Business for South Africa, with COVID Comms, Solidarity, South African Facilities Management Association. So yeah, we've made lots of big inroads. We've been in the media a lot. We've been on the news. We've been in both printed and video media. So yeah, lots and lots of background already, lots of depth to the Green Flag Association. So I think without further ado, Gareth is going to go through a good couple of slides, and then I will pitch in here and there, and then we'll kind of finish up with some important key messages. Gareth, I'll hand over to you. Thank you so much.
Thanks, Sean, and thanks to all of you for coming together to listen to this story today, and to my colleagues. So you may be wondering, despite the introduction, gas fundi, what an anesthesiologist is doing in the mix here. And I am in fact an expert in ventilation, but not exactly in the kind of ventilation that Sean and his colleagues are. Nevertheless, anesthesiologists have been on the front line of the pandemic. I have not personally, but in terms of intubating and mechanically ventilating the lungs of patients with COVID. So that's been a fairly, important position to be in the epidemic. And the interesting thing is that operating theatres are extremely well ventilated, in the other sense of the word, spaces where we've thought about air quality and the importance of clean air for preventing infection and other harm to patients. So my job as an anesthesiologist is actually to provide clean air and oxygen to patients while protecting those patients from the assault of surgeons. So the story that we're going to bring you up to date on is actually a very old story. It's literally 100 years old, of how to deal with a pandemic, and some of this has been lost. And there's a very interesting story that some of you may already be familiar with about how public health authorities sort of had a different narrative and a different scientific paradigm, if you will, about airborne disease until very recently. In fact, until perhaps this year. And we'll quickly reflect on that. But it's a very old story about how humanity, along the way, found ways to deal with pandemics despite the absence of vaccination or new medicines. These sort of exciting new scientific developments that should help us come out of the pandemic. The third element of the story today really is bigger than COVID and bigger than this global pandemic, which is about clean air and its implications for other airborne diseases and in fact for healthy living and long-term health implications. So what we'll talk about fairly quickly without too much of an academic flavor, which I do have a tendency to head towards, is how this started, how it's going, and then there's a so what. And mostly the so what, I'll turn it back to Sean for his expertise around ventilation and air quality. We'll end with some key messages for you that we hope you will distribute to the reading public from Green Flag. And the format today is really informal. So I personally am happy to be interrupted strategically. Sean will moderate. I guess he could watch the chat while I talk. And if there's anything that is really unclear or that you would like us to divert towards a little bit along the way, I'm more than happy to do that. So with that introduction, I'll head with any luck into the first slide, which is just to remind you that this kind of the milestone of March 23rd, which is last year, 18 months ago, where the president came on for his sort of fireside chat to tell us what we needed to do. And I don't recall whether this elbow forward is reminding us on the new form of greeting of bumping elbows, or whether it was, cough into your elbow, cough or sneeze into your elbow. But he had a range of advice for us via the public health authorities to say, coughing and sneezing, don't do it, or move away from anybody who is. And then a hell of a lot about sanitizing, cleaning surfaces, hand washing, and all of that. So that was what we were told, and encapsulated in this slide, that droplets from coughing or sneezing at close contact with individuals who were sick was how you got COVID, and that really you had to be incredibly careful about touching anybody or anything that might have been contaminated with coronavirus. And we sort of took that to town, and our groceries were sanitized, and we were terribly afraid of touching surfaces. And that was 18 months ago. So, what's happened between then and now? Well, back in February and March, the aerosol scientists, so the community that Sean is really a part of, and others around the world, already knew a lot and were starting to alert the public health and infection prevention people and virologists who actually operate in a separate sort of scientific world almost and publish their own journals, that we already knew a lot, or they already knew a lot about disease transmission of respiratory viruses. But there's a sort of clash of whether this was droplets, illustrated on the left here, of particles that are emitted by infected people, coming from your mouth, nasal passages, your airways and your lungs, and in the form of large droplets that would drop within a matter of seconds actually onto surfaces and contaminate those surfaces. And then if you were up close, a meter or two away, you potentially would become infected by the virus landing, or these droplets landing on your mucous membranes. So that's the one paradigm, and the World Health Organization, the CDC, our local infection authorities were promoting that as the basic model and would not use the word airborne to describe the pandemic. So in fact, what we now understand pretty clearly and has been accepted by these authorities today is that the majority of spread is through aerosols. And so aerosols are smaller particles that are also emitted from the respiratory tract and tend not to drop quickly, tend actually to be wafted away on air currents, and in an indoor environment will float and persist in that environment for minutes or longer. And those aerosols of transmission to others, and primarily in indoor environment. We're going to say that again and again over the next 30, 40 minutes, that this is the mode of transmission that has now been revealed to us and accepted to a large degree by experts. And sort of this is from literature. We can point you to various comprehensive reviews of this topic. And it captures the three basic modes of transmission, which we can call spray, touch, and inhale. Spray, touch, and inhale. And what President Ramaphosa and the advisors were saying is that spray and touch were what we needed to be concerned about. And all the interventions and prevention measures were focused around spray and touch. What we now understand is that spray and touch are not totally unimportant, but mainly the problem is inhalation of aerosols up close, so that's within that 1 to 2 meter proximity, but also at long distance, so meters away, 5, 10, 15 meters away in enclosed indoor spaces. So there's a lot of science about the size of the droplets and which ones drop and fall and which ones spread more easily, which we won't go into today, but there is a sort of a dividing line of 100 micrometers, which is about 1,000 times the diameter of the coronavirus itself. And droplets that are 100 micrometers or more tend to drop, and the larger ones tend to float away into the environment. So that's the kind of a take-home message. With any luck, this video will play for you, and Sean, you can let me know if we're successful or not, and the audio is coming through.
Video so far, yes. No audio.
Okay, so this video is from the NHS, and it's illustrating the emission of viruses in an indoor space. And this is not just the workplace, but any enclosed environment. And fresh air is a natural form of ventilation or mechanical ventilation using fans or ducts. Or it can be both fresh air or mechanical ventilation. Look for areas that smell bad or stuffy, or that don't have mechanical or natural ventilation. Look for areas that are busy, especially when it's for a long time. Small or cramped areas, carbon dioxide monitors, we'll speak about that in a moment or two. And we're concerned about badly ventilated spaces. CO2 monitors can help us decide whether there's a problem with ventilation and can tell us whether our ventilation is working properly. So don't forget about other controls. We can improve natural ventilation by opening windows and opening doors. We need to understand how your systems work and making sure they're working properly. Don't rely on recirculation units. Sean will explain that further. They just move air and COVID-19 around and will prevent you from identifying poor ventilation. We can use air cleaning or filtration units, but windows and doors should be open as much as possible. Vehicles, whether driving or parked, ventilators on, windows open. And open the doors to clear the air between trips. So this has been put out by the UK government, public health authorities, very belatedly, I might add. And the UK is an interesting example of a reliance on they're seeing 30 to 40,000 cases of coronavirus daily and 1,000 deaths a week. So I think we can take a leaf out of their book in terms of these videos, which have just been released recently, but perhaps not on their overall approach to the coronavirus pandemic. So sorry about the loss of audio there, but I was just kind of relaying to you what the audio track from that video. And again, we can refer you to some of those. They're quite good visual teaching. Okay, so I have a few more things to show you before I revert back to Sean. This is an important article that came out in April this year, summarizing 10 reasons in support of airborne transmission. So as I said, the CDC, the World Health Organization, our own authorities, only recently declared that COVID-19 was an airborne disease. And the authors on this paper, the 4 or 5 of them, are aerosol scientists and others who, and this is a 1 or 2 page article that's very good about relaying the scientific reasons in support of what we're talking about today. And I just want to talk about 2 of those 10 scientifically validated facts. So the first is the idea of a super spreading event, which we're all pretty familiar with, I guess. And this slide just illustrates 3 very, very well described super spreading events. All 3 of them were in China. These have been described all over the world. And what's common to super spreading events is that they're in indoor spaces, such as a restaurant, that's the illustration on the left, a school outbreak or an outbreak that began in a school. So that rather pretty diagram illustrates 2 school children. Those are the circled there, the 2 red squares, each child in a classroom infecting 10 or 11 others and then going on to infect over 200 individuals, a classic super spreading event beginning in an indoor space. And then the third is quite a nice story about 2 bus journeys, describing how many individuals got infected on each of those buses by one single index case who was first on the larger bus illustrated here, and then a smaller one. So super spreading events occur in indoor spaces, and the really amazing thing that actually points to a strategy for controlling the pandemic is that 20% of individuals are responsible for 80% of the infections that we see. And they're all about indoor spaces that become heavily contaminated with the coronavirus. I'm sure we've all heard about the R0, which reflects the number of individuals infected by a single infected person. And then this is just a diagrammatic illustration of that. So other diseases like influenza, a single person might infect one or two others. In COVID-19, a super spreading event, this shows that an individual might infect 3 or 4 others, but most of them don't infect anybody else. But then these large clusters tend to have a dominating effect on the pandemic overall. And as I said, they're all in indoor spaces. So what happens indoors and what do we do about it is the rest of the story for today. So the bottom line, the take-home message is that COVID is transmitted indoors and it's substantially reduced by indoor ventilation. What is indoor ventilation? It's really allowing fresh air to come in and stale air to be expelled. And without ventilation, infectious aerosols concentrate indoors. This is again reflecting on indoor spaces and the idea of super spreading events having a dominating effect. From Ireland, this is a little publication by an architecture professor at the University of Dublin, who has shown that more than half of people who have died from the coronavirus in Ireland were infected in just over 400 buildings. So that's 0.03% of buildings. And over half of the cases in workplace outbreaks were in just 150 buildings. Infection in overcrowded private homes occurs at the rate of uncrowded homes. So even in a home environment, ventilation is important in averting spread. And I think this is my final slide. I hope I can explain it adequately. So what this is saying, the x-axis is the distance from an infectious individual, and the y-axis is the inhalation risk. So the further away you get, your risk does decrease from an infected individual, and your risk goes way up if you're 2 meters or less. So that's consistent with the message that we have of a 1 to 2 meter distance. However, with poor ventilation, that's the black line, your risk is much, much higher. It's reduced by having sufficient ventilation, so that's the blue line. And that, if we can achieve sufficient ventilation, it gets us close to the level of risk outdoors, which is rather low. And it might be, this is just a schematic, and that outdoor risk is very low, 20-fold or less than indoors, and COVID outdoors is rather an infrequent occurrence. And so this is a good paper by one of the experts in the field. This particular scientist was involved with the SARS epidemic in Hong Kong and described, this pattern that we're talking about today. So, okay, so if the theme of today is how it started, and I'm saying that it was about droplets and contact, and how it's going is the idea that it's, yes, perhaps spray and touch to an extent, but it's predominantly about inhaling the virus and inhaling large doses of the virus. So one thing I haven't spoken to is going to come up next, and which is the idea of activity and what you're doing if you're an infectious individual spreading the coronavirus. The so what is the ventilation and filtration, which Sean will speak to, that we have to continue wearing a mask, I'm afraid, until certain sort of endpoints are reached, and we'll speak to that. The activity is the fact that infectious individuals who are breathing quietly will spread the coronavirus into an indoor space. But if they're speaking or shouting or singing, a loud vocal activity releases 10 times or more emitted particles and therefore is much more of a risk to other individuals. The big story really, as I said at the beginning, is about indoor air quality in general and what implications this has for our health as a society, and particularly in South Africa, where tuberculosis kills 50 or 60,000 people every year, is that an integrated approach to indoor air quality has the potential to dramatically reduce TB, the 10,000 or more influenza deaths each year, and possibly even to limit hospital-acquired infection if we really pay attention to air in healthcare facilities. And then there are long-term implications for indoor air quality in working environments, which Sean maybe will touch on. So the slogan one of the slogans we'd like to leave you with is V&V. So it's vaccines and ventilation. So I haven't spoken about vaccination yet, but this slide, which you'll see many places, this particular one is in the New York Times, says that there are many barriers to preventing infection, and we should pay attention possibly to all of them. So distancing, hand hygiene, wearing a mask, avoiding touching your face, financial support for people who are infected or to stay out of the workplace, etc., testing and tracing, all important. The ones we'd like to promote particularly today are ventilation and vaccination. Not all barriers are equal. Some barriers are personal, and so people need to take responsibility for their own behavior, but some of these are system. So vaccination is obviously a society-wide imperative initiative that we should all get vaccinated. It's now available to all of us, and ventilation similarly is something that we could take control of. So Sean, I'm going to flip back to you to the remaining slides, and I'll cover the presentation.
Thank you, Gareth. Really appreciate that, and yeah, really nice overlay of getting us to this point. So highly appreciate that. So yeah, folks, I mean, this is where we are. I mean, what are our vaccination goals? What is the Green Flag Association all about? What we're trying to do is that we are trying to keep the incidence rates as low as possible. 0 would be great. I mean, that's obviously we'll never get to that. We need to start working with understanding that this is going to become an endemic disease, and we will be working with it or living with it for time immemorial, I think. And we need to just understand that that's one of the things we have to do. But one of the things that is really important is that in order to keep the incidence rate down and actually get to that point that we can have let's call it a normal life, I think that the advantage of what COVID has actually brought us is this absolutely imperative that if we integrate it with the other disease and other disease managements of like around influenza, tuberculosis. Gareth, tuberculosis, kills how many people a year?
2019 figures were 58,000 deaths.
Influenza?
10,000.
Oh my gosh! So you can see that this integrated approach is that as a paradigm, we've actually recognized internationally that these diseases are all spread by the airborne route, and that what COVID is doing and is hopefully going to be doing through into the 2022 is actually upgrading building standards in terms of retrofitting them and working them out. So we need to get this daily caseload to below sort of less than 1, but I suppose we're working around about the 10 to 25. That would be great, and yeah, I think that would be a high success right there. Do you agree, Gareth?
Yeah, I think for policy making and sort of endpoints, this is one of the key issues. So I think everybody wants to know, when does the mask come off, and I think this is one of the factors that policymakers are considering or should consider.
Sure. And and so when we're talking about ventilation and our side and then the Green Flag Association side of it, it is all about rebreathe air. Remember, when you're outside and you're socializing outdoors, you're meeting outdoors, you're restauranting outdoors, you are sporting outdoors, or whatever it is, you are not breathing in rebreathed air. So what is rebreathed air? It's actually just exhaled air. So anybody that exhales in an enclosed space, that air becomes airborne, and then you would actually be potentially breathing it in. And so there's this direct correlation between disease and incidence of disease. And this is where we start getting right to the crux, the real bones, right underneath the meat of everything. So we understand that healthy buildings are the first line of defense. So if we have to put an imperative on, is that we need to have healthy buildings. And we're currently dealing with about 45 years of very bad building planning. And it started with the Cuban Missile Crisis and the oil crisis and all those sorts of things that happened in the 70s, where the Americans actually then decided that we needed to have energy efficient buildings rather than healthy buildings. And so that they developed their standards within ASHRAE, which is basically their standard levels that they work through. And they said, you need to make sure that the building is more energy efficient. And that means that you would compromise on fresh air, because fresh air coming into a building actually costs money to either cool down in South Africa's case of context, but it's actually quite expensive to also warm up as well in the American situation during their very cold winters. And what happens with American standards is that they actually spread all over the globe. And South Africa was certainly caught up in that maelstrom of standard changing about 45 years ago. So currently our standards are set at about, I don't know, 7 liters, between 5 and 7 liters per person per second. And internationally, if you're looking at the European standards, the standards are a lot different. So they're looking more at like 10 liters of fresh air per person per second. And that's an important dynamic, because if you really understand how the disease works, is that if you look at this, is that if you're getting a rebreathe situation in enclosed air, if you're looking at the carbon dioxide concentration in an enclosed room, the carbon dioxide starts at about ambient over here. However, as more and more people are inside that, engaging in that area, and they're breathing out, the carbon dioxide concentration just keeps on going up, goes up. And so what happens is that rebreathed air is contaminated air, contains the virus, contains tuberculosis, contains influenza. So it is the causal link for all outbreaks. And we need to seriously recognize that. And what happens when you get this causal link occurring, when you get this contamination of an internal environment, you get this explosive spread, what we're calling super spread, but it's an explosive spread of the disease. So we know for sure that the disease is airborne. And we also understand, and there's a paradigm shift going away from that dogma that Gary was busy talking about, and that the dogma of sort of touching surface contact and all that. And they are barriers and they are important, but they are not as important as fresh air. They are actually a hell of a lot less important than fresh air. So yeah, when you go out and you see this, you see the messaging in shopping malls, etc., you actually see the messaging is still wash your hands, sanitize, wear a mask. Still important, but there's not enough ventilation going out there. So internationally, there's this massive paradigm shift. There's a lot of countries that are starting to adopt and change their standards now, Germany being one of them, Finland being the other. Americans are doing it. REVA, which is the European Union for Ventilation Specialists, are constantly updating the ventilation standards and that. So very, very important for us to understand how important it is for rebreathed air. And an example that you could think of is that if you get into a vehicle with somebody and you keep your windows closed and you keep your air conditioner off, you very quickly become stuffy. But if you put that air conditioner on, you'll find that you start feeling cool straight away, but you might not necessarily understand that there's either fresh air or no fresh air inside that, and we'll talk about that a little bit later on. So if you're looking at a wall-mounted air conditioner inside a building, that is generally just a recirculation system, and it might make you feel cool, and it's only when you bring out the carbon dioxide meter do you recognize that you're breathing in a hell of a lot of rebreathed air, because that carbon dioxide concentration is actually on the skyward pivot all the way to the top. So we know that Joseph Allen is one of the guys that I've been following all the way through, and he's really a high academic scientist in aerosol science and understanding the causal link between carbon dioxide and the spread of disease. So time indoors is in an underventilated space. It doesn't matter if it's a spin class or choir practice or a restaurant. It's the same fundamental underlying factors that are driving the transmission. So whatever people are doing, the public are doing indoors, that is what is driving the transmission. It doesn't matter whether it's in a class, in a classroom, in a vehicle, a taxi, public transport. That is what's driving. That's what's driving it. And this makes me really quite despondent and nostalgic, I suppose. But back in January 2021, I stated emphatically that there seems to be this continued lack of clear messaging for coordinated or policy response from national government, from big business, to the pandemic and the indoor air quality beyond 2019. And this is something that I would like to see us change. And I mean, as the media, I would really hope that you guys would engage in this idea that we need to stop and we need to stop the dogma, the perpetuation of the dogma, and we need to change the idea of everything to be around ventilation, because that is really where the crux is, where the tire meets the road. So what are we asking for? We're asking for, if this is the why, this is the limbic system of exactly what it is. This is what resonates with us scientists all over the world. This is what it is that when you're breathing, rebreathe air, it is the contaminated air. And so the ventilation is the key to ending the pandemic and the endemic as it goes for tuberculosis, and as we get COVID into an endemic situation, to dealing with influenza, and actually stopping broadly the amount of sort of death and disease burden that we're carrying as a country and as a planet. And so really, if you take nothing away from this today, take the idea that the rebreathed air is the situation. We need to take that rebreathed air and we need to actually ventilate it out of buildings so that wherever we are and we're socializing or working, that we are sitting there breathing really good and decent air in it. The other important part of it around the ventilation is, what can we do? Open doors and windows of buildings, it's pretty easy. Certainly when it comes to public transport, we've done a lot of work around that, and we've been in quantum taxis, and there's been a lot of work done in Johannesburg with the Ministry of Transport, and we successfully calculated pretty much the sweet spot to discomfort within the vehicle, but also enough ventilation. And that's actually to open all the windows, importantly the front windows of those vehicles, to be cracked to about 5 centimeters and all the way through to the back. Then you get this good through flow of thing, but also opening doors and windows in spaces. And this is an interim measure, because in the future, the standards with the National Building Regulations and SANS Code 0400 will need to be updated to include carbon dioxide monitoring as a standard, as well as higher ventilation rates. As I said before, the ventilation rates at the moment are about half of where the European Union are going at the moment. Very importantly, you've got to check, service, repair all the existing HVAC systems. Now, your HVAC system is your central air conditioning system. If you're sitting in an office, generally you've got two kinds that you can see when you look around. You'll either have a wall-mounted air conditioning unit, which we know is rubbish, doesn't even circulate. All it does is circulate the stale air, just cools it down. So you just perceive it to be better, but it's not. And then you've got the HVAC system. A lot of these HVAC systems have actually got some good design features in them, but the dampers and the fans and the ducting systems are all clogged up and that. And some of them haven't been serviced for 15, 20 years. So Gareth said early on in a slide where just a few number of buildings can actually result in a very, very high caseload. And we certainly see that inside the field of practice as well. We want to head for what is the European standard. It's a minimum ventilation rate of 10 liters per second per person. And then we also would absolutely call for the monitoring of carbon dioxide concentrations on a permanent basis within built environments, because it's a very rapid test to be able to say, if the carbon dioxide concentrations are starting to be elevated, we can very, very quickly dial in and actually have a look to see what the story is over there. And we've got lots and lots of examples, and we're gathering quite a lot of data, even in South Africa at the moment. We've got to filter the air. Yes?
Sure, I'll interrupt you for a second. Just waving my carbon dioxide meter for everyone to see. And I don't usually put it on in my own indoor space in my home office, but I'm noticing that actually it's a little high, and we can do a little experiment right now, and I'll open the doors and windows, and we'll see it go down from around 1,000 where it is, and we'll see where it goes to.
All right. Well, you can see that's obviously from the presenting, the talking, shutting the sound outside of your door in your office, etc. And so you get that elevated and escalated dioxide concentration. And I'm sure when we see the doors and windows opening now, I can't see that because my screen is full of the presentation. But yeah, keep us posted over there, Gary. Thanks. Obviously, then you can filter the air as well. So if there's a situation where there's no natural ventilation or the outside weather prohibits the use of natural ventilation and the HVAC system doesn't work, then what's actually happening internationally is that you can start putting filter systems in, and this is called a HEPA filter or a MERV 13 and above filter. And we don't have to get into the technical detail, but there is a way where these boxes get located in your office, and what they do is they recirculate the air through those filters. The big and important behavioral area is to avoid crowded indoor spaces. I know personally I frequent to a local restaurant and I really like their food. The chef is one of the best chefs in South Africa and he's a Durbanite, and I really, really enjoy the place. However, often when I go in there, certainly on a Friday, it is too crowded, and I turn on my heel and I get back in my car and I go and look for something a little bit more sort of well ventilated. Meet and play outdoors, incredibly important message for your readers, because we've got a South African summer on the go at the moment. What better for South Africans to actually sit and meet and play outdoors? Really such a key message to keep the levels low. And if we could actually get this right, we will save hundreds of lives, hundreds of hospitalizations, and a lot of sick people that won't actually even get sick at all. Obviously, wear a good quality and well-fitted mask when you're indoors. So we now understand that the mask is a contentious because it's uncomfortable situation, but that mask is a high preventive mechanism within indoor areas. So when you're out and about, no mask in general, although it's still the law that you have to. We don't advocate for the use of masks in uncrowded areas outdoors. But certainly indoors, you must continue with that. Very important. Gareth, have you got anything that you'd like to add to this screen at all?
Well, I'll just update you on the experiment. So what I did was I opened the window, and the carbon dioxide was kind of holding at around 1,000. I then opened the door behind me so that we now have a free flow of air across the room, and the CO2 is plummeting. So it's now at 800, and it's just below 800 right now. So in about 30 seconds, there was a flow. So it wasn't sufficient to open the window. You had to have both the window and door open so that there's a flow of air across the room.
Yeah, certainly, and that certainly correlates with, if you look at the video that you posted earlier and the definition of what ventilation is. Remember what ventilation, the very definition of the word ventilation is not an oscillating fan or when you feel air movements on your skin. The idea of what ventilation is the introduction of fresh air through an entire area that it services that entire area. So through flow ventilation only doesn't occur just with one window open inside an area. You need to have an opposite air aperture or window or door open so that it actually travels all the way through. So yeah, thanks for that, Gareth. Keep us posted if it changes again. So what do we say? We are asking, and this is our key message for today, is that you need to go all in. The scientific community is really pushing hard. The Green Flag Association has been operating at policy level and has been going through so much and putting this message out there relentlessly from the tops of rooftops and soapboxes for more than a year now. And we are still not getting this message. And so what we're asking the media to do is to really, really push this idea that fresh air is the area. The dogma around sanitizing and wearing masks is already established. But what we don't have is this paradigm shift thinking where we have to use fresh air as our most important and critical intervention. So we ask you to just go all in with fresh air and vaccination. The Green Flag Association itself, if your readers have got any issues with not understanding whether their place is well ventilated, what they need to do, or if they want their staff to feel more confident, we've been working with banks, we've been working with some pretty big firms and houses to help them understand their ventilation systems. What the Green Flag Association does is allow for people to contact the Green Flag Association through the website. Certainly my email address will be supplied a little bit later on, and Gareth's too, but get hold of us and we can come and actually inspect that area and do Green Flag certification where we will look. And what we've also managed to organize is the Proudly South African initiative, which is this Green Flag carbon dioxide monitoring device. And what it does is that we can install it within buildings and within houses and within boardrooms, meeting areas, sports events, or whatever it is. And we can continuously, by minute, actually keep proper tabs on what the ventilation is doing and what the carbon dioxide concentrations are in that occupied space. And what would happen is that if there's an exceedance, and our level is 800 parts per million, it's aligned with the international REVA level of 800 parts per million. And what we would do is we would actually get an SMS or an email to the building manager to say, look, yeah, this area is overdue or is actually in a non-compliant situation, go out and check it and inspect it. So very dynamically manage the ventilation rates within occupied spaces. So I think if you want to maybe talk about Grooteskiet and your experience there, Gareth, if you don't mind.
Sure. I'll come in with a quick story here. So this is a recording. What on your screen right now is a recording from these devices, and the device was placed in Grooteskiet Hospital in the anaesthetic department seminar room, which is an enclosed indoor space. So it's a classic setup for a super spreader. And as things are returning to a more normal kind of mode of interaction, last Friday was the UCT anaesthetic department's annual research day, and there were about 25 people in the seminar room. So we placed this monitoring device ahead of time, a couple of days before the indoor air quality. We also had one of the engineers come in and check the space for flow there. It turned out one of the main vents in the room, which would allow fresh air to come in, was actually closed off. So I think they did something to correct that. And then I actually have able to view this a record on my cell phone. So I was able to reassure my colleagues meeting last Friday in this enclosed space that the air quality was excellent. The CO2 rebreathed air levels were below the 800 threshold that Sean has remarked upon. And even if there was someone infectious in that seminar room, the odds of others becoming infected would have been greatly reduced.
Wow. Yeah, such a real world practical example. And I can share a couple of stories, and I know there's a few fun, but that really brings home exactly how useful it is. And this is Tafiso, and he's one of the Green Flag inspectors. And there's enormous challenges with this. And I've been an exposure scientist for my entire career, I suppose 30 years, and really indoor air quality has been a bugbear for pretty much the duration of it. And so these are very common kind of events where you'd find areas like, if we measure inside cars, for example, taxi buses, where we're getting 5,000 ppm, and the ventilation is not right inside there. So it is a crazy situation. And so it's really worth noting. So I think if you really like to get hold of us, I know, Gary, this is pretty much what you'd like to maybe talk to as well, if you don't mind.
Well, this is just sort of an end piece here, which is, at the beginning we had certain beliefs about how the coronavirus was spread, and we now have a much better understanding and some public health messages that should get out strongly, get fresh air, continue to wear a mask in the indoor spaces primarily, and to get your jab. And believe it or not, that is our president with a CO2 meter supplied to him by one of the Green Flag members. And he seems to be quite enjoying learning about rebreathe the air and perhaps monitoring his own personal spaces, or who knows, up in the parliamentary offices, hopefully, to keep everyone safe.
Yeah, interestingly enough, I think I've stopped sharing now, right? So interestingly enough, that exact instrument is actually currently in the UK, following the rugby, and yeah, getting lots of data from pubs and all that sort of thing. And it's actually quite crazy that the UK is that their standards are so much worse because of, I suppose, the way the buildings are designed than what ours are. The potential for relief for open windows and that for South Africa is at least pretty good. I don't know, Gareth, if you've got some examples from New York where you took your instruments.
Sure, I'll tell you that story and then we'll go to questions. And there are a couple from Tamar, the Khan Business Day, in the chat, and we'll go to that in a second. But my other little story is I was fortunate enough to be able to travel in August and September to the US. And New York is a heavily vaccinated city. And, you know, we were there, so we decided we would take the subway despite some trepidation about that. Turns out that subway cars are actually quite well ventilated. Fresh air comes in, and they have MERV 13 filters in the roof of each subway car. But I have a photograph that's in one of my other presentations, sitting on a subway car in the Bronx outside Yankee Stadium. So we went to a baseball game, which is a lot of people, but it's all outdoors. So I consider that to be a pretty safe environment outdoors. And then we took the precaution of heading back home a little early, walked out of the stadium, down to the subway station, and to take an early train. But it turned out the trains were delayed, and by the time the train arrived, the subway station was extremely crowded. So we got on the subway car. It was end-to-end people, but everyone was wearing a mask. And I had my CO2 meter and I watched it go up to quite high levels. But as I said, those subway coming in the top, which you need in New York in the summer, and the air is also filtered through HEPA filters or MERV 13 filters. So none of us got COVID, and New York is kind of controlling its pandemic better than most other places in the United States. So we'll just go to the questions now. So Tamar asks about, I'll put her second question to you, Sean. She says, what advice do you have for businesses and employees returning to work in large numbers? For example, if they lease office spaces in a large building with windows that do not open, should they abandon ship, or is it possible to make that kind of space safe to work in? So that's a great question.
Yeah, thank you, Tamar. That is a really good question, and it's one that's actually that we come across as well. You know, especially if we're looking at banking environments and some of these high security type of environments where you've got double access, biometrics, etc., coming in. And you know, there's been on occasion where we've looked at these office areas and the carbon dioxide concentrations are pretty high, higher than spec. As well as when you look at the ventilation systems, they actually don't have a fresh air inlet component to them. And so then you've got to start managing congregation settings and density settings and you have to start managing your staff. So it is a very, very difficult area. Personally, I would not go into an office that wasn't properly ventilated, and it would certainly be a contravention of firstly the national building regulations, which actually does require that some fresh air is introduced, and secondly would be a contravention of the hazardous biological agents regulations, would be a contravention of the health and safety directive from the Department of Employment and Labour. So it's a contravention all the way through to not have ventilation at all or access to ventilation. So those officers can be retrofitted. I would imagine that whatever ventilation system they've got, they would have to have a proper look to see if they can actually bolster it up somehow, or use some kind of hybrid system where you would introduce maybe some fans in the windows. They would have to learn to open those windows. Very, very difficult situation though. Not very common. I think there are a few, as I say, there are a few examples that we have encountered, but generally you can do something for them. But if you can't, yes, advantage. Gareth, any insights at all?
Yeah, so I would just add, so there's something of a movement or a social movement in the US and now in the UK around providing air filtering devices, particularly for schools, DIY devices actually that can be fabricated out of 4 commonly available in the US anyway, furnace filters and a box fan, and you can make something like that for $100 and sort of, you know, clean the air if your ventilation isn't sufficient. So I think there's some solutions there, but I think that, you know, it's really time to try to focus on the major areas of risk, and building managers and tenants should start to look really hard at these systems and environment. There's the other question from Tamar. Sorry, Sean. One other question.
Sorry, if I just come in there as well, and I think the air filter space is actually something that's still the jury's still out. It's been wholesale adopted in the US, and the UK is definitely starting to enter into it. But you know, an unhealthy building is, you know, it really is an interim measure, and I think it applies. What you really want is a healthy building. You want that fresh air in there rather than that it's actually recirculating through a filter. So I completely agree with you, Gareth. So also that is probably the best interim measure as a response. But yeah, to get fresh air in there is always the way. Thank you. Next one, Gareth.
Thanks, Sean. So Tamar's first question was, can you provide any examples of documented super spreader events in South Africa that have occurred in poorly ventilated indoor settings? And the one that jumps to mind is the Tin Roof nightclub in Cape Town. So this was back in, I think, in the first wave. I can't remember how many infections were traced to that particular super spreader event, but there you had it. Sort of a nightclub, which is a loud crowd, so I like to say a loud crowd indoors, and many, many people infected in a particular setting. One thing perhaps, really a hospital outbreak at St. Augustine's Hospital in KZN, it's really interesting to read that report, because that report is built on this paradigm of droplets and contact. And there's some really interesting statements about, you know, this couldn't be airborne because I think, and I've actually challenged, sent one of the authors a note to say, would you perhaps reflect on this now as whether it was, you know, attributable to poor ventilation and sort of super spreading within the hospital itself. But those were back last year, and I personally am not aware of any published reports of other super spreading events. There may well be, but I'm not aware of them. I don't know if you are, Sean.
Yeah, Gareth, in South Africa, unfortunately, because of the contact tracing stuff, and as well as our high numbers, they are difficult to formally analyze. But as the Green Flag Association and some of our inspections, we have come across examples where one person went in infected to a restaurant, and 14 cases came out of that in a single sitting around the same table. And those sort of things, we understand with the Delta variant being about 4 times more transmissible than the Alpha variant, you've got a hell of a high super spreader potential. And I think there's also the Rage was maybe one of the official ones, last year's Rage. And I think there's actually quite a big calling on Green Flag's side to maybe stop or at least limit or control that a little bit better. And that happens in Ballito. I think it's imminent. So we'll keep tabs on that. But certainly, I mean, I suppose tomorrow, even if you're getting into a taxi and you contact a case, and you're getting into a taxi, you're traveling for 30 minutes in a taxi and you are shedding, the chance of you getting out that taxi still being the only one infected is actually pretty small. And this is what we understand. I mean, when we start getting to our numbers of 20 to 20 and above 20,000 a day, this is the story that we are seeing. And it's only lockdowns that kind of solve this. So yeah, this is where we are, avoiding lockdowns. That's what we're trying to do by this presentation.
Thanks, Sean. Yeah, I've forgotten about Matric Reg, and I think definitely last year it had perhaps maybe one of the prime initiating events, super spreading events. Lots of kids, loud crowds. So there's an interesting question from Jeff for you, Sean. Have you done any work at underground mines? What were the results? And Jeff, if you'd like to elaborate on the question.
Yeah, Jeff, yeah, I would imagine that I think he's probably calling from Diamond or Coal, but I think probably Diamond. But yeah, Jeff, we haven't done any work underground. I think there might be some work in there, but I would imagine if there's the ventilation system in mines is actually really, really good. Generally, there's a lot of fresh air being replaced all the time. So you'd be working more running more on a proximity issue. For a drive-in mine that doesn't have a reef like a gold mine, you could probably get away with certainly just not that much of a congregated area other than maybe canteens and that. But reef mines, I would imagine there's probably some issues with the congregation in the lift as you're going down and ending your shift and coming back up again. Obviously, open cast mining is well ventilated, and the guys have the biggest probably risk is around sunburn rather than something else. Yeah, thank you.
Thanks, Sean. I don't see any further questions in the chat. Is there anybody else that would like to put up their hand, come in with a question or clarification or a review of anything that we've said today? Danny, would you like to say anything?
If you don't mind, I just want to add that both myself and some of our colleagues at Green Flag's PR agency will be sending out a press release as well, and in it we'll have a link to a recording of the webinar. So that should go out a little bit later, and we'll make sure that all of you get a copy of it. Thanks.
All right. Well,
thanks, Danny. I see
Gary?
Sandra is
sorry,
Sean, Sandra is typing something, and I'm just waiting for that to come through. Or Sandra, if you just answer the question. Okay. Would you be open to sharing copies of the presentations with the attendees? Yeah, certainly we can do that.
Yeah, absolutely. Yeah, so I suppose, Gary, thank you very much for your time, and certainly thank you to the media for attending this. Special thanks goes to Laura and to Lily and to Danny for the work that goes on, and obviously to the expert panel of Green Flag Association. You know, we don't do this in isolation or in a vacuum. We stand on the shoulders of giants, and the people that we work with shoulder to shoulder give a lot of their free time and effort to be able to do this and keep the public sort of updated, and we really, really do appreciate that. And yeah, and really thanks to you for attending. You know, time is the biggest gift that you can ever give anybody. And I think this is like, to dedicate time to this and this subject it's never been more opportune right now as we go into December. And we really just hope that the people get out there, and we want the public to get out there and really enjoy December. And don't wear a mask if you're outdoors and socializing, and there's lots of space between you and the next people, I suppose. That's maybe a little bit contradictory to the law, but the science supports that as action. So, yeah, guys, thank you very much for attending, and highly, highly appreciate it. Gareth, if you'd like to close off, if you don't mind.
Yeah, thanks, Sean. I'm just looking at my carbon dioxide meter, and it's come down to 500 or so, which is close to the outdoor air concentration in parts per million, which is usually around 420. So, you know, back to the science here, we have a way of measuring this that's convenient, and we can all, you know, be in much safer environments if we're aware of ventilation, and we can mitigate or perhaps even stop the next wave of the coronavirus pandemic while improving, other health measures, including, who knows, perhaps our, recurring enormous problem of tuberculosis and other respiratory diseases. So I think, if we could sort of activate business, government, civil society around these issues, I think it could have a big impact, and then we could have a December and January, hopefully, without the enormous disruption, suffering, and death that we've seen in the previous waves of the coronavirus pandemic. So thanks very much to all of you for your time, and we have to field questions by email. We'll make the presentations available to you. Thanks very much.
Thank you. Lily, you can stop recording now. Thank you.
Thanks, everyone.